And we're back with Grace Ballard with Foundations Behavioral Health. Grace, welcome.
Thank you, Sam, so much for taking the time and to have me here today.
Glad to have you here.
Yeah.
What is Foundations Behavioral Health?
Foundations Be Health is we are an outpatient behavioral health clinic here in Claremore, Oklahoma. We serve all the surrounding areas. We serve all ages, 3 to 103. We pretty much take all insurances, and we're a group of specialized practitioners. Most of my practitioners have specialties in play therapy, and trauma is one of our main focuses. It's treatment of trauma. Trauma would be an event, event out of the norm of human experience, but trauma is a fact of life, really. I mean, for one person, trauma might be something that's not trauma for another person. So not just PTSD, but all forms of trauma, and sort of from our perspective, and a lot of the research is catching up with us today, that most mental illness, most behavioral problems are really in fact caused by some form of trauma. As well as substance use. And substance use, as high as 87% or more, that trauma is an underlying reason that they go to drugs to numb out from the pain. And so we are holistic providers. We have a Reiki provider who uses an energy healing. And then I'm trained in something called somatic experiencing therapy, which is for clinicians, mental health clinicians, doctors, physical therapists. We treat the whole body. So what we know about trauma is that it's a mind-body thing, and so you may know that it happened in the past, but your body still is stuck in the past. So you need a body-centered, holistic treatment to bring those two together.
Don't you feel like sometimes you're swimming against the current? Because the opioid crisis in Oklahoma is off the chart, and it's getting worse.
I'm glad you bring that up, Sam, because that's what we've been seeing. So Foundations has been in practice for 8 years now. And we have found we've been treating a lot of youth, and many of them are being raised by their grandparents or other relatives or in the foster care system because of the opioid crisis being such a problem in Oklahoma. And so with that, we began to look at how do we really, really help these people. And the other piece of that is that we have a large Native American population that we serve. We have roughly 70% of our clients are Native American. And Native American population, there are more opioid deaths in that population, and an average of 23 more pills prescribed to the Native American population of opioids just prescribed, not even on the street.
You're kidding me.
That's what the statistics are showing. And so we got really curious about how we can help prescribed opiates. If you compare the races of prescription for opiates in Oklahoma, there are the 23 more pills on average prescribed to a Native American clients versus
Sounds
another
almost like a
population.
dismissive treatment.
That's, to quote that exactly, so we are Cherokee owned now. We became Cherokee owned last year when our practice became mine and my husband. My husband is traditionally raised Cherokee and Cherokee. And he said, to quote my husband, Joseph Ballard, he said that white man's medicine got us into this mess. We need something different to get us out. And so that is what we are looking at doing here. And so we applied for a grant in April of this year, a Department of Justice grant. We found funding.
Oh, this is a big grant. This is a big deal, isn't it?
Yes, big deal, big deal. So I am really grateful for you having me here today because we really need to get the word out about this grant.
You got about 2.5 minutes. Tell me why.
Okay. So because we have $125,000 to help treat the victims of this opioid crisis, mainly youth and their families. And we're focusing on the Native American population because that's the group that's been hit the hardest. And so we have this money where we can provide them services for free, and we're using their culture as a healing piece, because we know that culture is a protective factor and a healing factor for people. And so we are bringing them in touch with their culture. We're doing cultural surveys with them. My clinical director is Cherokee. He's bringing in cultural things such as the medicine wheel, and we're bringing them back to their culture as part of the healing treatment, as well as the trauma, the holistic trauma treatments that we do at foundations.
Don't they need an attitude adjustment, if you will? I mean, don't they need to be able to, I want out of this vicious cycle before you can do anything for them?
Well, sometimes you can help them get there. Sometimes that's motivational interviewing is an important piece that all of our clinicians are trained in. When people are like not quite there in the change cycle, there are specific interventions like motivational interviewing that can help them resolve their ambivalence and help them find what's important. So yeah, sometimes people need help, but we can help them get there.
Grace, thank you.
Thank you, Sam.
We're out of time. Will you do it
Okay.
again?
Yeah,
Well, then mark it down and we'll get with you on that.
okay,
I'd like to know how far this money goes, how you're able to use it,
okay.
and we'll find out down the road. All right, our next guest is Dana Gray with the Oklahoma Alliance for Animals, and she'll be along right after this.